Remove the prepackaged extraction buffer. Tear the seal off the tube pre-filled with diluent. Insert the buffer into the hole. Remove the cotton swab from the package.
Do not touch the cotton wool on the end of the cotton swab.
Insert the cotton swab into a nostril gently. Insert the tip of the cotton swab 2 to 4 centimeters. Swirl the cotton swab along the nasal mucosa 5 times within 7 to 10 seconds. Repeat the process with the same cotton swab in the other nostril. Dip the head of the cotton swab into the diluent. Squeeze the sample tube with a cotton swab 10 to 15 times to mix. Rinse your mouth with water before sampling to remove food residue. Cough deeply, make the noise of crua from the throat. Release it into the paper cup once the sputum/oropharyngeal saliva is in your mouth. Use the dropper, add 1 drop, about 0.2 milliliters, of sputum or saliva into the specimen tube. Place the dropper on the test tube.
Shaking 10 times at least.
Keep it upright for 1 minute.
Place the test kit horizontally on the table.
Add 3 drops, about 100 ml, of the sample to sample whole S. Waiting for 15 minutes and reading the result.
After test, disinfect the test cassette using the alcohol pad.
Place the disinfected test cassette into the biohazard specimen bag.
Dispose all test kit materials via biohazard waste disposal protocol.